Welcome. Today, me, Hannah Lee, and Haley are going to talk about Fellowship Health Resources, which is an adult day program located in Raleigh, North Carolina. And the primary population that is served are those with mental illnesses. And the primary reason that they go there is to prevent rehospitalization and to help them become as independent as possible so they can hopefully live on their own one day. The primary diagnoses that are there include schizophrenia, intellectual disability, substance abuse, as well as depression. And then some of the goals that we just pulled from our experiences and from what clients told us is that they wanted to become their own legal guardians, they wanted to obtain a job, they wanted to obtain the ability to live on their own, as well as getting things like driver's license, being able to manage their medications as well as possible, and even things as simple as using their email or accessing Facebook. All of those goals are just goals that we saw fit within OT's role and are important to the people at the clinic.
Okay, so some of the services that are provided at Fellowship Health, it's important to know that there are no OT services that are there right now, but we've seen a big need for OT services. The disciplines that are available right now are social workers, case managers, as well as peer supporters. And the social worker is primarily in charge of the supervision of the treatment, and the case managers make sure that the treatment plans are being implemented appropriately, and the peer supporters just support the consumers that have similar diagnoses. So some of the big themes, this chart was given to us by Antoinette, the social worker lead at Fellowship Health, and it was kind of a guide for what we could work on while we were there. So it includes vocational skills, education, mental health recovery, so peer support groups, social and recreational activities, life skills and independence, which we felt that we really fit into, culinary, studio, which is more of an art focus, advocacy, substance abuse recovery, and physical fitness and health programs.
Okay, so this is a potential OT role, and what we've done is kind of created the OTPF matrix. So we started with the client factors impacted, which is pretty much like a higher level of cognition, executive function, and flexibility and insight. And then we focus a lot on attention, memory, emotions, and then temperament and personality. And then with performance skills impacted, we focus a lot on process skills and social interaction skills. So with sequencing, attending, leads, inquires, initiates is a big one. And as far as social interaction skills go, like regulation and transition, especially between groups and with each other, and expressing emotion and benefiting from the groups and services that are offered. And prevalent occupational deficits, a lot of it is independent living skills. So ADLs, big one with self-care, rest and sleep, IDLs, which is a big area, money management, grocery shopping, communication skills, home maintenance, driving, and then a lot of education, and then work as far as vocational skills go. And so the OT intervention activity ideas that we came up with for Fellowship Health could be management activities such as money management and medication management. And then we thought about internet scavenger hunts for houses, for looking for jobs. And then emotional regulation crafting activities, which they've done a little bit of that there now. Exercise group, meal prep groups. And so then over here we have probable OT goals that we've created. So a patient will be able to identify 5 out of 7 computer icons in order to search and locate preferred internet sites with verbal cues in 2 weeks. And then patient will create 10 item grocery lists 2 times a week for 4 weeks in order to identify items for meal preparation. And then patient will attend 2 one-hour group sessions per day without any physical or verbal outbursts with mod independence and verbal cues for 6 weeks.
So one of the biggest things that we've realized being at Fellowship Health without an occupational therapist there, our biggest job right now has been building rapport with the clients. So getting to know them and having them trust us so that we can work on the things that are meaningful to them and get the information of what is meaningful to them. And then breaking that activity down into the component skills. So for instance, one of our clients wants to get a job, so breaking down what that means, how they're going to get to their job, the component skills for that job, and then being able to work with them for that. Thank you for listening.